You're welcome to another episode of Fertility Talk with Olarunke Thaddeus. Last week we started a topic on fibroids, and in the series of next episodes to come, starting from now, we are going to start discussing the treatment option one after the other, so that even from your own perspective, you will be able to know which one you need. So today's topic is uterine fibroid embolization. Uterine fibroid embolization. A lot of women prefer a solution where they will not be cut open. A lot are scared, they are afraid of surgeries and would want an alternative. You would hear questions such as, is there any drug to use to shrink my fibroids, and the likes. So on today's topic, we are discussing embolization because it's an oral treatment option that can help to shrink your fibroids. But however, if preserving your fertility or having to give birth after is what you are aiming at, then is this treatment option the best option for you? Okay, so let's get to the topic proper. Uterine fibroid embolization is a minimal invasive procedure used to treat fibroid tumor, and usually this procedure is usually recommended when a woman has menstrual bleeding, heavy menstrual flow, and when a woman experiences painful menstruation or there is a pressure on your bladder. This is when this procedure is usually done, and this is a minimal invasive procedure that uses X-ray called a fluoroscope to drop embolic agents into your uterus. And the main aim of these agents is to block your arteries and cut away blood supply to your uterus so that the fibroid would shrink. So many studies have shown that nearly 90% of women who undergo uterine fibroid embolization experience significant or complete resolution of their fibroid related symptoms. Okay, this means that this procedure truly works. All the symptoms would disappear. How does fibroid embolization work? The procedure involves inserting a catheter through your groin and maneuvering it to the uterine cavity, and the embolic agents will be passed through your arteries that supplies blood to the uterus, and the fibroid will start dying off once there is no blood supply to the uterus. So it's a very lovely procedure to do, especially when you are about to enter menopause and childbirth is no longer on your mind. Okay, so let's talk about the risk and benefits of uterine fibroid embolization. Okay, it has some risk though, and it also has some benefits. Uterine fibroid embolization, usually it is done under local anesthesia, and of course it is less invasive, like I said earlier on. It's less invasive, no surgery as such. Okay, so that's one of the benefits. Also, no surgical incision is necessary, only a small cut on your skin, and it does not even require any stitches at all. It will close up by itself. Okay, so you would naturally will resume activity almost immediately, maybe a day after the procedure. Usually, studies have shown that women who have their fibroid treated with uterine fibroid embolization may either experience significant or complete resolution to their fibroid symptoms. I've said that one earlier on. All the symptoms will disappear, which means it works magically. This is also true for women who have heavy bleeding, as well as who have bulky related symptoms such as frequent urination or pressure on their pelvic. Okay, on the average, fibroid will shrink to half of their normal volume, and in about 20% reduction in diameter. Most importantly, they soften after embolization, and the no pressure will be on your pelvic again. Some studies have shown that usually when fibroid embolization is done, that it is impossible for it to regrow back. But there are also some other studies that have shown that yeah, it might grow back. That is a function of your age. If you are closer to menopause, then the chances of it growing back is very, very slim. But if you're younger, then the chances of it reoccurring also is high. But some other studies have revealed that the fibroid would be completely gone after uterine fibroid embolization. So let's talk about the risk associated with the procedure. As beautiful as it is, it can clear up your fibroids, shrink all your fibroids will disappear. But yes, there are some risk entails. Okay, any procedure that entails catheter being passed, insertion under your skin and all that would definitely have some minor risk. Usually this is not something to worry about, okay? Especially if it is done by a good radiologist, then you don't really have anything to worry about, okay? Of course, the risk of infections are there, and this can be mitigated by taking antibiotics. And even at that, though we can't completely cut off that risk, okay, because after the procedure, the fibroid will start degenerating, and some would also be removed. You will have some fibroids inside. So after the procedure, you might also need a D&C to help you to remove the remaining fibroids. And if there is an oversight, then okay, so you might have an infection. And another major risk is that there is always a chance that the embolic agents that are being dropped into your uterus can also drop elsewhere, thereby causing the flow of blood to other organs. That risk is there, but of course, this risk is also mitigated against if you are using a very good expert for this procedure. Some women also react to embolic agents used in this procedure, and their reaction would range from mild to severe itching, and even an increase in blood pressure. You know, this risk is also mitigated by having a nurse at your bedside that would be watching you for that period that you are in the hospital. In the majority of women who undergo uterine fibroid embolization, normal menstrual cycle resume after the procedure. However, in approximately 1% to 5% of women, menopause would occur after uterine embolization. These appear to occur more with women that are above 45 years old. Although the goal of uterine fibroid embolization is to cure fibroid-related symptoms without surgery, some women may eventually need to have hysterectomy because of infection or if the symptoms persist. The likelihood of having hysterectomy done after your fibroid embolization will depend on how close you have to menopause. But however, the likelihood of having hysterectomy after your fibroid embolization is how close you have to menopause. Even though some studies have identified that after uterine fibroid embolization is done, you don't need to worry about fibroid growing back again. But you know, like I said earlier, this is a function of your age and how close you are to menopause. But however, it is not possible to predict whether the uterine wall is weakened by uterine fibroid embolization, which might pose a problem during delivery. So therefore, if you've done fibroid embolization and you want to deliver, usually I would advise that you do a cesarean section, okay, because the full effects of uterine fibroid embolization on your uterus is not well known, okay? Of course, just like every other procedure, there are also limitations to this procedure. One of it is women that has no symptoms, such as heavy bleeding, pains, and the likes, should not do uterine fibroid embolization, okay? And also when cancer is envisaged, then this procedure should not be done. Women with serious allergy issues that contains iodine should also not do uterine fibroid embolization. And you know, this now brings me to the main issue here. What effects does uterine fibroid embolization has on fertility? That is a question a lot of physicians, gynecologists struggle with. The full impact, the full effect of uterine fibroid embolization on fertility is not well known. Some studies have shown that you can get pregnant after uterine fibroid embolization, but there are a whole lot of studies that have shown that after this procedure, getting pregnant is like 50-50. Okay, so because of this, uterine fibroid embolization is not advisable if you still want to preserve your fertility and if pregnancy is what is on your mind. What I want us to do is that I want as many women as possible that has done uterine fibroid embolization to share their experience with us. Please send us a DM. Let's know what happened after your surgery. Were you able to achieve pregnancy after your surgery? If so, please kindly share us more information so that we can also add it to our own studies. Thank you for watching today's episode of Fertility Talk with Olarunke Thaddeus. And for more inquiries, kindly send us a DM or comment below. And don't forget to subscribe to our YouTube channel and follow us on Instagram at @MeetSurrogateMothers. Take care.